An anterior lumbar interbody fusion, or ALIF, the acronym's just ALIF, so a lot of times you'll hear that term, is a procedure where me and a vascular surgeon make an incision below the belly button and move the blood vessels to the side. I take the disc out and then put a spacer block in. So the reason why we would do that approach through the front is because typically we need more stability of the back. So your underlying problem would typically be degenerative disc, so the disc is bad, the disc is wearing out and causing the pain. It's usually for either that reason or because there's instability of the back. There's abnormal shifting of the bones or a scoliosis. And in those scenarios, the name of the game is to get stability, to stabilize the spine. If you don't get a good fusion with good stability, the surgery won't help you. Well, the reason why we want to do it through the front as opposed to doing it through the back with taking the disc out and putting a spacer block through the back, which we can do and I do for different scenarios, is because when you go through the front, me or anybody else, you can get all of the disc out as compared to some or most of the disc out when you go through the back. And you can put a spacer block in through the front that's about 7 times as big as the one that we put in through the back. So when you have a graft that's 7 times as big, your chance for fusion is much better, and the fusion that you get is much more solid, much more rigid, giving you that stability that you need. That's the reason why you'd want an anterior approach as opposed to an all posterior approach. To get started today, fill out our form on our website or give us a call and we'd be more than happy to schedule you for an appointment to answer all your questions.